All right, so today we're going to unpack a real mystery in medicine, fibromyalgia. It's a condition of chronic, widespread pain, and we're going to take a close look at one of its common treatments, Ambien. This is really a story about what it's like to manage an invisible illness and the incredibly delicate trade-offs that come along with it.
So I want you to imagine something for a second. Think of your body's pain-sensing system like a smoke alarm. It's there to protect you. But what if that alarm was faulty? What if it started blaring from the slightest touch, or maybe it just never ever turned off? That's probably the closest we can get to describing the daily reality for someone living with fibromyalgia.
So here's our game plan. First, we'll try to unravel the mystery of what fibromyalgia even is. Then, we'll get into how it's diagnosed, explore a pretty common tool used for sleep, run through all the crucial safety precautions, and finally, map out the pretty big ripple effect of its potential side effects.
Okay, let's start with the condition itself. For decades, fibromyalgia has been this puzzle for both patients and doctors. It's a really frustrating condition of widespread pain that just seemed to defy any simple explanation.
So here's the official definition. It's a chronic syndrome, which just means it's long-lasting. Its key features are widespread pain, all over, and tenderness. And the source of this pain isn't obvious, which is exactly why it's been so tricky to understand for so long.
And this slide really shows how our understanding has changed over time. Back in the 70s, it was just seen as a bunch of symptoms. But today, the medical world gets that it's a disorder of central sensitization. Now what that means is the central nervous system itself is basically turning the volume way, way up on pain signals. It's that faulty pain alarm we were just talking about.
And this is absolutely crucial to understand. Fibromyalgia is not an autoimmune disease like rheumatoid arthritis. There isn't actual tissue damage or inflammation causing the pain. Instead, it's a neurological issue. It's a problem with how the brain and the spinal cord are processing all that pain information.
So this leads to a pretty big question, right? If you can't see it on an X-ray or find it in a blood test, how on earth do doctors diagnose it? Let's take a look at how all these invisible signs actually build into a real clinical picture.
Okay, this is fascinating because it breaks down the two really distinct ways patients experience this amplified pain. So first you have hyperalgesia. That's when something that should hurt a little, like a small pinch, feels excruciatingly painful. Then there's allodynia, which is even more bizarre. That's feeling pain from something that shouldn't hurt at all, like, say, the feeling of a bedsheet on your skin.
But it's not just about the pain. The condition is really defined by this whole constellation of symptoms. The pain is diffuse, meaning it's all over, and it can even feel like it's moving around the body. A crushing, brutal fatigue is almost universal, and when you combine that with the pain, it can make even basic daily activities nearly impossible. And it's not constant. It comes in waves, with flare-ups and periods of remission.
So, to make this diagnosis official and move past just describing feelings, clinicians now use a very specific checklist. First, the symptoms have to be chronic, so they've got to last for at least 3 months. They also have to be widespread, covering multiple regions of the body. And then, patients also have to meet certain scores on standardized scales that measure both how widespread the pain is and how severe the other symptoms are, like fatigue and cognitive issues.
Now, when you're living with constant pain and fatigue, it often leads to another huge problem, insomnia. And when you can't get that deep, restorative sleep, the whole pain cycle just gets worse and worse. And that is where certain medications can come into the picture.
One of the most famous is zolpidem tartrate, which you probably know by its brand name, Ambien. It's what's called a sedative hypnotic, and it's designed specifically for the short-term treatment of insomnia. And it's really important to point out that while it might feel similar, it's not in the same class of drugs as benzodiazepines like Xanax or Valium.
So how does this stuff actually work? Well, it basically acts as a central nervous system depressant. It targets these key areas of the brain that are involved in being awake and falling asleep. The thinking is that it boosts the effects of a neurotransmitter called GABA, which is what calms down nerve activity. The end result? Sedation, which helps you fall asleep, and even a little bit of muscle relaxation.
But, and this is a huge but, a powerful tool for sleep like this does not come with some pretty significant risks. This brings us to a really crucial part of our explainer, understanding who should be using this medication with extreme caution or maybe not at all.
Right off the bat, certain groups are at a higher risk. Its use is cautioned against during pregnancy and breastfeeding, and it's definitely not for anyone under 18. Older patients tend to be much more sensitive to its effects. And interestingly, females often clear the drug from their bodies more slowly, which means they might need a lower dose to avoid feeling groggy and impaired the next day.
And the list of medical conditions that require caution is even longer. Because it's a nervous system depressant, any breathing condition like sleep apnea can become really dangerous. It's processed by the liver, so any liver disease is a big concern. And critically, a history of depression, suicidal thoughts, or substance abuse are major red flags for any doctor thinking about prescribing it.
So now we get to the other side of the coin, because even for patients who seem like good candidates for the drug, the treatment itself can create a whole new set of problems through its side effects.
And we're not just talking about minor annoyances here. As you're about to see, the potential side effects of Ambient are so wide-ranging, they can touch pretty much every major system in the body, creating this really complex web of new issues for patients to deal with.
The most common side effects, not surprisingly, involve the central nervous system. This includes the stuff you'd expect, like drowsiness and dizziness. But it also includes more troubling things like confusion, anxiety, and even amnesia. And maybe the most concerning of all are these complex sleep-related behaviors, where people do things like drive cars, cook meals, or make phone calls while they're not fully awake, and then have zero memory of it the next day. And the impact doesn't just stop at the brain. The GI system can get hit hard, with people reporting everything from nausea to diarrhea. And there are even potential effects on the heart, like chest pain and palpitations.
And in a really strange twist of irony, a medication that's used to help with a pain condition can sometimes cause muscle pain itself, which is called myalgia. Even more seriously, it can trigger severe allergic reactions. And while it's rare, it can also mess with your blood cell counts. It just goes to show how a single pill can have this huge, complex impact on the whole body.
And this quote really just captures the heart of the whole issue. For someone with fibromyalgia, finding any kind of relief is this constant negotiation. It's an incredibly delicate balancing act between managing the awful symptoms of the illness itself and carefully weighing the very real risks that come with the treatments that are supposed to help.
It leaves us with one last big question to think about. When you're dealing with a chronic illness that is already a massive puzzle, can the treatment, with all its side effects and precautions, become just as complex to manage as the disease itself? It's a challenge that patients and their doctors have to navigate every single day.